Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. We're observing World AIDS Day, December 1st, and that makes this an important opportunity to take a closer look at those who are living with HIV and AIDS and what IDPH does to assist them. Joining us for this conversation are Andrea Perez, she's the section chief for HIV/AIDS at IDPH, and Marleigh Andrews-Conrad, who is the Ryan White Part B program administrator. Both work in the Office of Disease Control at IDPH, and thank you both so much for being here. Andrea, I'd like to start with you to talk about the current situation. How many people in Illinois are living with HIV and AIDS, and are the numbers going up or down or staying stable?
Hi, Jim. Thank you. So there are currently 38,480 people in Illinois living with HIV, and numbers are going up. It's important to remember, though, that the overall increase is a combination of a number of factors, not just new diagnoses. Now, of course, new diagnoses contribute to the increase in total number of cases because we have more diagnoses each year than we have deaths among people living with HIV. We have people that are living longer, and that's contributing to the number staying kind of more stable and larger, right, among people living with HIV. And we also have to figure in the people who've tested positive, maybe in another state or jurisdiction, who move into Illinois as they also get counted in our total number of cases. So again, a number of factors that contribute to that total number.
And as you noted, people are certainly living longer with this diagnosis. That is a great thing, and something we'll be talking more about in greater detail in just a moment. I want to talk a little bit about where HIV and AIDS are most prevalent and among whom are we really seeing this in the state.
Right. So geographically, we definitely see more cases in Chicago and suburban Cook County as well. Um, Cook County, inclusive, of course, of Chicago, accounts for just about 2/3 of the total number of cases in the state of Illinois. And within those numbers, we do have African Americans still accounting for the greatest share of new infections. Currently, or in 2023, that number, or that rate, I'm sorry, was 38.4%. Hispanic or the Latinx community is behind them at 34%, with whites coming in at 17.8%. Now, overall, this indicates a bit of a shift among or between the racial and ethnic groups, with new diagnoses among Black females being down over previous years and new diagnoses among Black males being down significantly over the last few years, particularly when we're talking about men who have sex with men. Um, we're seeing the gap between African Americans and the Hispanic Latinx community closing, with both decreases among the African American population and increases happening within the Hispanic Latinx population.
And we'll be talking more about some of the efforts to slow the spread of HIV and AIDS, the prevention-focused efforts coming up here in just a moment. But I also want to talk about something that you noted just a moment ago. We're going to bring into the conversation now Marleigh Andrews-Conrad, Ryan White Part B program administrator at IDPH, about the fact that when AIDS was first identified, now more than 40 years ago, it was seen as a virtual death sentence, but a lot has changed since then. So I'd like to talk about some of the key medical advances that are helping people live full lives even after an HIV diagnosis. Marley?
Thank you, Jim. Absolutely. So, compared to the beginning of the epidemic, HIV medication has really advanced and evolved in a significant way. Um, the very earliest HIV regimens used to be very complex. For example, a person living with HIV at the time might have had several multi-pill regimens a day that were timed in very strict windows of administration and had very unpleasant side effects. Uh, but today, some HIV regimens are only one pill a day, and there are even injectable options that provide benefits for 1 to 2 months. So these factors are really making treatment more manageable, and promote medication adherence among patients. And it's really also contributed to folks being able to manage HIV as a chronic disease instead of a life-threatening illness as it was at the beginning of the epidemic. So one thing that's really important in the advancement of medication is um, something called undetectable equals untransmittable. You might also hear folks call this U equals U. And just to provide some background on that, uh, the amount of HIV virus in someone's system is determined by a blood test called a viral load test. And with medication, it's actually possible for a person's viral load to become undetectable on these tests. It gets so suppressed that it becomes undetectable. Um, and in recent years, the CDC has supported that people who achieve an undetectable viral load are not able to pass the virus to their partners. So not only is this an awesome breakthrough for prevention, but it's just really empowering to a person living with HIV to know um, that they can achieve U equals U and stop the transmission of the virus in that way. So really the key to ensuring best quality of life for people living with HIV is to assist them on getting on treatment as soon as possible after their diagnosis, because the faster that someone has access to treatment and can achieve viral suppression, the better their overall health and wellness will be.
A couple of key acronyms as we talk about prevention, slowing the spread, are PrEP and PEP. So, Andrea Perez, talk about these programs, what these are, and how IDPH works with local health departments on them, and the effectiveness of PrEP and PEP in achieving that goal of slowing and stopping the spread of HIV and AIDS.
Sure. So a PrEP stands for pre-exposure prophylaxis, which is just a fancy way of saying prevention before exposure or potential exposure. PEP stands for post-exposure prophylaxis or prevention after exposure or potential exposure. So antiretroviral medications are used in both PrEP and PEP for people without HIV who may be exposed through HIV through sex or injection drug use. These are the same medications that Marleigh was just talking about that people with HIV are taking for the treatment of their HIV, but they're used a little bit differently in this scenario. So with PrEP, someone takes a daily pill or gets an injection every other month. They're monitored by their provider and they must test negative for HIV before starting PrEP. And it's important to do periodic testing while they're taking PrEP to ensure that they have not become infected and need to switch gears, right, from prevention to treatment. PEP is medication that prevents HIV after a possible sexual or injection exposure. And with PEP, it must be started within 72 hours or 3 days from a possible exposure. So it's incredibly important that someone who is interested in PEP after a possible exposure contact their medical provider or the local emergency department as soon as possible. Also, anyone who is interested in PrEP or PEP can visit hiv.gov. They put in their zip code, some address information to find a provider near them. And the other thing I wanted to mention is that IDPH does administer a program called PrEP for Illinois. PrEP for Illinois covers the cost of PrEP medications for people with a PrEP prescription from a medical provider. So anyone interested in that program can visit prepforillinois.com. And from there, they can get more information about PrEP generally. They can find a local provider to prescribe PrEP to them, or they can apply to the PrEP program. Also, you did mention local health departments specifically, and we do fund a number of local health department clinics throughout the state to provide PrEP services to people free of charge, so they can be that prescriber. If people, don't feel comfortable going to their own provider, or they aren't able to find another provider in their area. And all of those local health departments can also be found on the prepforillinois.com website.
You're listening to This is Public Health with the Illinois Department of Public Health. We're talking about HIV and AIDS in Illinois. Our guest, Andrea Perez, Section Chief for HIV/AIDS at IDPH, and Marleigh Andrews-Conrad, the Ryan White Part B Program Administrator here at IDPH. Andrea, another key to slowing or stopping the spread of HIV is through easy access to testing. So where does someone go to be tested for HIV, and how does IDPH support the availability of testing?
Yeah, so there are a number of options for HIV testing these days. In addition to someone's own healthcare provider, it's offered at a number of local health departments, like we just talked about, throughout the state, as well as a variety of community based organizations. Some hospital emergency departments also offer HIV testing just as a routine part of care for someone being seen in the emergency department for any reason. IDPH supports a number of clinics and CBOs with grant funds to provide testing to the community, making it completely free of charge and confidential. Testing locations can also be found at hiv.gov, but also there are at home tests that can be taken. People can purchase these. Pharmacies, think Walgreens, CVS, even Walmart, I believe Targets even carry them. And there are programs that are supported throughout the state and in various parts of the country where someone can access one of those tests free of charge as well. So they can administer the test themselves very simply in their own home and get the results right there, and then have access to additional services depending upon what the result may be.
We want to turn back now to Marleigh Andrews-Conrad, Ryan White Part B Program Administrator. If someone is diagnosed with HIV or AIDS, there are a number of support services they may very well need. So talk about the types of programs and services that are available, starting with the Ryan White Part B program.
It's a federally funded program that was established nearly 30 years ago because it was identified that people living with HIV really needed assistance to be able to focus on their wellness especially when other life priorities came up. And the costs of HIV medication and other services can be very extensive. So we certainly don't want that to be a barrier to someone getting essential support that they need when living with HIV. So in Illinois, there's sort of two components to the Ryan White Part B program. And the first is at the statewide level where we assist eligible clients with accessing their HIV medication and health insurance at no cost to them. The second component of Ryan White programming actually is more of a local endeavor. We've got 8 regions in Illinois where local organizations and providers assist people living with HIV by connecting them to resources. And this is done under a case management model. So case managers are dedicated folks out in the field that help clients navigate the HIV landscape and really work with them on prioritizing and achieving goals that will help them live a healthy life. And through this model, they're able to help clients obtain assistance with many services. The healthcare related services that are available to folks through local programming include outpatient medical care, oral health care, mental health care, and substance use treatment. And there are also opportunities for clients to obtain social and supportive services like housing, food, transportation to medical appointments, and more. And these services are really meant to alleviate the burdens that might cause barriers to HIV treatment for folks. So if we take one of those, for example, like housing is incredibly vital to any person's well-being. Not having housing makes it really difficult to focus on your health, and having a safe place to live and sleep is a huge contributor to positive health outcomes. And for many people living with HIV, achieving a healthy life and that viral suppression that we spoke about before without the stability of housing would just not be possible. So overall, providing these holistic services to folks really results in higher rates of viral suppression, and that's evident throughout program data.
Another major component in the fight against HIV and AIDS is education. So, if you would each talk about the role that IDPH and its partners play in educating people on prevention of HIV and AIDS and other sexually transmitted illnesses.
Sure, so you're right. Education is absolutely key. The more people know and understand about HIV and other STIs generally, the less stigmatizing and frightening they become. And the more people understand about the risks and behaviors that they engage in personally, the more prepared they can be to protect themselves and their partners. We fund awareness campaigns that are visible to the general public, both through grants that we provide and campaigns that we kind of create and put out there ourselves as IDPH throughout various parts of the state, as well as funding one-on-one or individual level education interventions delivered by our grantees and partners.
Marley, anything you would add on that?
Yeah, absolutely. So, even if a person is already living with HIV, um, there's still a lot of ways that those people can be educated and empowered to contribute to the overall prevention of HIV in their communities and among their partners. So, teaching folks about being undetectable, that U equals U, and best practices for treatment adherence are really important aspects of preventing new HIV positive cases in Illinois. I do want to echo something that Andrea said. I think that more education to the public about prevention and U equals U can be very beneficial in reducing stigma around HIV. Um, really trying to normalize testing, practicing prevention methods, and helping people understand that HIV is a manageable condition is really important to ending the epidemic in our state.
And hopefully, this podcast is also helping with that effort to educate people on that. We have covered a lot of ground here. And so, if people would like to find out more about the topics we've discussed here today, Marley, where can they go for more information?
Sure. So, in regards to specific HIV care services available in Illinois, I'd like to share a website called HIV Care Connect, www.hivcareconnect.com. This is a website that's maintained by the Illinois Public Health Association in partnership with IDPH. And it has really great resources for both people living with HIV and for medical and social providers to learn more about what is HIV, how can I get treatment, what are some trends in HIV that we can consider, and so that we can assist folks in the best ways.
And will you spell that website out for me, please?
Sure. It's www.hivcare.com.
Any place else that you would like to recommend that people go to check out if they need more information?
Well, I think we mentioned HIV.gov a couple of times earlier, and that one is very good, even though that is a national website, unlike HIV Care Connect, which is really more specific to Illinois. There are some service and resource locators on that page that will still connect people to local services, but the general information is absolutely sound and cuts across geography.
You can also search for information on HIV at the Illinois Department of Public Health website, dph.illinois.gov. I want to thank again our guests, Andrea Perez, Section Chief for HIV/AIDS at IDPH, and Marleigh Andrews-Conrad, Ryan White, Part B Program Administrator. Thank you both so much for this important conversation here on This is Public Health with the Illinois Department of Public Health.